Hi everyone. Today we are going to discuss about CRRT. CRRT means continuous renal replacement therapy. First one, introduction of CRRT. CRRT is used to replace normal kidney function and it is circulating the patient blood through the filter and returning into the patient. Continuous renal replacement therapy is also known as a type of hemodialysis. Then it is indicated for the patients with acute or chronic renal who is clinically unstable or traditional hemodialysis, and for patients with a fluid overload. It's a secondary to oliguric and renal failure for patients whose kidney cannot be handled their acutely high metabolic or nutritional needs. Then CRRT does not to produce rapid fluid shift, does not require dialysis machines or dialysis personnel to carry out the procedure and can be initiated quickly. Then definition of CRRT: continuous renal replacement therapy is a slow and continuous blood purification therapy used in ICU for critically ill patients with severe acute kidney injury. It means AKI or multiple organ failure. It's unlike conventional dialysis and it returns 24 hours and providing gentle remove of waste and excess fluid. It making it ideal for patients with unstable blood pressure. It is also known as unstable blood pressure and other patients means hemodynamically instability. Then indication of CRRT. There are several indications, like first one is severe acid base disorder, then the severe electrolyte abnormalities, refractory volume overload of CRRT and intoxications, severe septic shock. Severe septic shocks means like oliguria and 200 ml in 12 hours. It's anuria, it means the less than 15 ml in 12 hours. Then hyperkalemia, it's the potassium range 6.5 millimole per liter. It's greater than 6.5 millimole liters. And severe acidemic pH means less than 7.1. Then acidemia, it's a urea and greater than 30 millimole per liter. Then uremic conditions, it's a significant organ edema, it's like lungs or heart overload. Then the purpose of CRRT means it reduces the hemodynamic instability and preventing the secondary ischemia. It's the greater uremic toxins removal and the effective control of uremia, hypophosphatemia and hyperkalemia. It presides the volume control and immediately adaptable. Then purpose of CRRTs is acid base balance. It's rapid control of metabolic acidosis. Then the electrolyte management, it's a control of electrolytes imbalance, management of sepsis and plasma cytokine filters. Complication of CRRT, it's a patients who undergo CRRT is vulnerable to many complications, especially when they are critically ill. First one is hypertension, then risk associated with the anticoagulation therapy. Patient's coagulation status is carefully monitored. Hypertension means in some cases inotropic supports required to maintain the MAP. The risk associated with anticoagulation therapy, it's like bleeding and coagulopathy. The patient's coagulation status is carefully monitored and looks for signs of bleeding such as decreases the hemoglobin level or drop in the blood pressure. Then the introduction of infections is the main complication of CRRT. It's through the pure aseptic technique when handling the circuit and filters of. Then it can also envelop the vessel and has been patient for extended periods of time, particularly. The femoral sides and vascular lines have the short form span. The monitor of signs of infections like redness and swelling, heat at the site. It is increase the temperature and increase the white blood cells. CRRT can cause electrolytes, acid balance and imbalances constantly. Monitor the patients of the signs and symptoms and looking for at the blood results. Contraindication of CRRT, there is no non-contraindication. It's like continuous renal replacement therapy, and CRRT is intended for continuous operations. Principles of CRRT, first one is convection. Convection is refers to the movement of dissolved solids or molecules which are in plasma water across the semi-permeable membrane. There is a movement of occurs or an area of higher pressure to an area of pressure at the size of the molecules, and the air are related to the size of the pores in the filters. The filters fluids is discarded and replaced by chemically similar replacement. Next, ultrafiltration. Ultrafiltration is a movement of volume and the area of high pressures and low pressures across a permeable membrane. The difference between the ultrafiltrations of convention is first related to the movement of fluids, while second is related to the movement of dissolved molecules. A large amount of fluid can be removed during ultrafiltration. The replacement fluids are essential and reduce the risk of hypovolemic conditions. Next, diffusion is the major part of the CRRT, and the diffusion means the movement of a substance from an area of concentrations to an area of lower concentration. In CRRT, it is done by passing a dialysate reflecting normal blood chemistries, prismazole, and this means that the excess waste and within the blood will diffuse out and replacement electrolytes and molecules will diffuse in it. Different modes of CRRT. First one is, it is the important part of the modes of CRRT. There are 5 types. First one is slow continuous ultrafiltration. It is also known as SCUF. Then CVVH. It means continuous veno-venous hemofiltration, and CVVHD, venous hemodialysis. Then the fourth one is CVVHDF, continuous veno-venous hemodiafiltration. Then the TP is therapeutic plasma exchange. Slow continuous ultrafiltration means SCUF. It's the principles of ultrafiltration to remove excess fluid and body. Therefore, it is called treat to fluid overload process, and it works the pumping machines patient blood through the filters and which separate the blood fluids and molecules according to the size of the filter pores. It means the patient blood through a filter and it will separate the fluid. These are generally very small in this model, so not be loose in different solutes. Then CVVH, it's continuous veno-venous hemofiltration. Its principles like ultrafiltration and convection. And the process of CVVH means the size of the pores in the filter is allow the further molecules to pass into the filtrate, and the fluid is filtered from the blood. Then it is replaced with suitable fluid with a chemistry similar to normal blood, which is applied to either pre or post dilution. Next, CVVHD, it's continuous veno-venous hemodialysis. The principles of CVVHT is diffusion of molecules across a permeable membrane along a concentration gradient. The process is dialysis with similar G normal blood to pump the counter current through the filters. Any molecules are greater the concentration and blood are drawn across the dialysate and removed from the body. Molecules which are low in the blood are also replaced by the normal levels in the dialysate. Then hemodialysis, CRRT, CVVHT. It means the principles of CVVHT, ultrafiltration and convection and diffusion. These are the main principles of continuous venous hemodiafiltration. The main goal means like fluid removal of small to medium molecules. Solutions are used in CVVHTs like dialysate and fluid replacement. It's a process and dialysate returns counter current to the blood flow, increases the effusive clearance. It fluids and molecules removed, convention and ultrafiltration. TPE is therapeutic plasma exchange. These are the final steps of CRRT modalities. This mode is designed to separate the plasma from the blood through the special filters membrane. The plasma is then replaced by mixture of fresh and frozen plasma and albumin. The plasma exchange of therapeutic plasma exchange has been shown good results in removing harmful cytokines in conditions. Then Behr syndrome, Goodpasture syndrome and thrombocytopenia, purpura, and these are the conditions of therapeutic plasma exchange. Procedures of plasma therapeutic exchange management of CRRT is first one assess and vascular catheters and x-rays, then blood samples. Assess means the assess required for CRRT is temporary for treatment and the assess of choice to develop lumen catheter. Vascular catheters are placed in the medical practitioners and during the sterile procedure into the intrajugular, subclavian or femoral are secured by suture. An X-ray must be performed to ensure the correct placement. The blood samples need to test for ABG analysis. These are the main procedure of CRRT. Then as usually has this lifespans of 7 to 10 days. They are placed in the subclavians, intrajugular vein and up to 5 days when replaced to the femoral vein. The main complication of vasculitis are introduced to the infectious organism and clotting of the lumens. The last one is AV fistula, arteriovenous fistula. When renal replacement therapy will be required longer temporary treatment, especially in chronic renal failure patient, then formation of AV fistula in the patient forearm will be considered. Nursing management of CRRT. First one is patient assessment, then assess hemodynamic and fluid volume status by monitoring hourly vital signs. Patient assessment like assess for the signs of infections including redness, swelling, increased tenderness and drainage at the access site. To obtain the temperature fourth hourly or not to any increase. Hourly intake and output fluid volume status by monitoring Vital signs is CVP and PA pressures at 50 minutes interval at the onset of treatment and until stable every half hour during the treatment. Unstable and every fourth hourly when thus be dialysis. Patient management is primer filters, blood circuit and heparinized saline administered the physician order, heparin bolus to patient. For CVV HD administer dialysate through the filters and counter current to blood flow. Set the blood pumps to rate and apply the air venous pressures and detect the devices. Next, if the orders infuse the replacement solution, usually hourly via the arterial side or venous side. Replacement are based on the filtrations rate known as UFR. UFR is high, then the volume of depletions will occur. Thank you.